So we're now going to kick off the second part of this track with a really interesting discussion with profound implications for both health and the economy, the economics of aging societies. As populations age, governments are facing rising healthcare and pension costs, while shrinking workforces threaten growth and productivity. At the same time, fertility rates remain below replacement levels, and conventional policies have so far struggled to reverse that trend. So to explore what next steps might look like, please join me in welcoming Javier Sánchez-Prieto, Chief Executive of IVI RMA Global. Welcome.
Hi, thank you.
Yes, welcome.
Okay. Wow.
Yeah.
No, thank you very much, and thank you for having me and giving me the opportunity to speak.
Yeah, it's great to have you with us. So I thought, could we start broad? Because a recent PwC report projects that by 2050, health and pension costs are set to add nearly 5 percentage points to the UK's GDP. So how urgent is the need to tackle fertility and demographic decline as an economic issue, not just a social one?
Well, that's a great question. I think that there's been a lot of debate about what we call the aging equation. So we have rising life expectancy, we have declining fertility ratios, migration not playing a big role so far. That's for another day. I think that we have all the developed countries below the replacement rate, the UK, the US, Spain. And I think that this has an implication on age structures that are changing from pyramid and really going into obelisks. So a lot of the population, 1/3 of the population in 20 years, 30 years, will be over 65. And I think that brings at least to two big challenges. One is the economic. We're going to talk in a minute. The other one is the societal one. And look, when we think about the economic implications of that, we have seen that the workforce will be shrinking, that more elder people will be actually still working. So what are the implications of that into innovation, into productivity? There are a lot about that. There is also an implication, as you were saying, on the support systems. I mean, it's back in 1950, every person over 65 was supported by 8 people, below 65. That number today is 4. In 50 years, it's projected to be below 2. So I don't know. I mean, we'll figure that out.
Yeah.
The thing is, if we don't change something now, that's coming. There's nothing that we are actually doing that is moving the needle. I think that the governments have failed actually with all the mechanisms trying to encourage people to have babies.
Yeah.
And I think that basically we have focused maybe on the wrong group of people, because I think that instead of encouraging people to have babies, we should actually address this group of people who wish to have children, but really struggle with infertility.
Absolutely. And we're going to come to that in a second.
Yep.
But I wanted to dig into more of these incentives that you've talked about, because for decades, governments have tried this. Things like tax breaks, vouchers, parental leave, a lot of sort of economic interventions to convince people to have more children. But the fertility rates have continued to fall in the face of these efforts. So can you say more about why you think this isn't working?
Well, at the end of the day, in my opinion, there is one factor, and so living longer has changed the way we all look at our lifespan.
Yeah.
It's like we're taking decisions maybe later, but nature is not actually evolving at the same pace. So according to the World Health Organization, 1 in 6 of the people in that age struggle with fertility problems. And this basically the main factor that correlates, it's just the age of first pregnancy. It's just that. I mean, many people could have, male problems, female problems, but the main factor is actually the age of first pregnancy. And when you look at this, we have the privilege of being based in 15 different countries. We have statistics about the different countries and how this is evolving, and how is also the penetration of IVF in the different countries, and there is a clear correlation. So the age of first pregnancy in Spain is 33, in the US is 26. In Spain, close to 12% of the babies born every year are born with the help of IVF. In the US is 2.7. So, and then it's very easy to actually kind of connect the dots. So that's coming. That's in a country like the US, that's coming, because every year what you see is that in 5 years it increases from 1 to 2 years the delay in motherhood. So let's say the level of quote unquote infertility problems is something that we can actually connect the dots and see where we are going in the different countries. So it is a situation that I think that we need to take action now. And as I was saying before, I think that we have been focused on the wrong group of people, trying to encourage people who don't want to have children. And instead, I think that we will need to focus on helping people who actually want to have babies.
And can you talk about what some of the barriers are that might be leading to that, leading to the fact that policymakers are sort of not focusing on this group? Is it cost? Is it regulation? Is it stigma? What are some of the challenges that are, are preventing that sort of shift in focus?
I mean, I'm very new to the industry, just to be completely transparent with the audience here. I think that simply this has been simply overlooked. There are very few statistics. The only one I have that is kind of solid is one from the CDC in the US. They ran like interviews and then research, and they found that 9.7 million women wanted to have children from 2015 to 2019. Just to put this figure into perspective, every year 3.5 million babies are born in the US. The US gap to the replacement rate is 1 million. So you have like a group of 9.7 million women who wish to actually have children, and they're not actually looking for help to do that. I think that governments has been more and more open to provide the structures to get different strategies when talking about treatments. I think that the stigma, the social stigma, is also going down. So that is also a plus. It is positive. And to be honest, even our industry is not the same industry that it was 10, 15 years ago in everything. I mean, in regulation, in safety, in the clinical outcomes. So I think that we are in a moment now where we could be part of that solution. And yeah, that's where we are also trying to do, is to create more awareness, so people who wish to have children can actually be helped.
Definitely, that makes sense. And part of that equation is access. So I'm curious, how can governments ensure that access to fertility treatments is equitable? So it's not just wealthier families who can benefit, but also those who may not otherwise afford it, because infertility affects everybody, really.
Yeah. Well, it's interesting. Again, looking at different countries, completely different strategies. In the UK, I think that the number of babies born with the help of IVF is between 3 and 3.5%. In Spain, it's almost 4 times. Both markets, let's call it that way, are out of pocket. So many people is actually paying for the treatment. There is, of course, a public sector also, but it is similar. Let's say the weight of the public sector, both in Spain and in the UK, is similar, with very different outcomes, with somehow similar prices when you look at at both countries. The US, it's a different strategy from the government. So basically, almost everything is public, but I would say that 60-70% of the market is covered by the insurance, so it's the payers. Last week, I was in Abu Dhabi. In Abu Dhabi, for instance, the policy from the UAE is completely different. They pay for everything. They pay 100% of the treatment. So in some way, they're getting it right, because not only they pay for the treatment, they pay us providers per quality. That makes a lot of sense. I mean, if you think about it, I mean, if I have better results, I can get like a better price for that. So for the burden for the government is lower, and not only for the government, the burden also for the families and women in particular, not going through 2, 3, 4 cycles because the provider is not it doesn't have the quality that it is this well at the end of the day fits. So I think that I don't think that there is a huge problem now about getting access. You can get access to the public systems, you can get access to the private system, you can get access via payers or insurance companies. I think that there is more on awareness and people not actually looking for help. And that's where we're trying to push to get more people actually make more people aware of the problems can be actually the challenges can be solved.
Interesting. I have so many more questions for you, but we're out of time. I think if you can wrap up really quickly, I'm curious if we sort of zoom back out now, beyond addressing failing fertility in the first place. I'm curious how investments in reproductive medicine can intersect with other priorities when we think about gender equality, workforce participation, and even sort of innovation-driven economies.
Yeah. Well, difficult to actually rank all those, very important.
Yeah.
I think that when you think about the long term and you think about the implications and challenges that we're gonna face, I don't wanna draw like a very disastrous future. It's not that, but the challenges, economic challenges, societal challenges. We need to think about people aging alone. So 1/3 of our population in 30 years in the US, in the UK, in Spain, will be over 65. They are actually concerned. There is research that says 50% of those, they are really concerned about how the system will look after them in the future. Mental health. So all the implications, the tax implications of, I don't know, raising debts where population is shrinking. I think that this is one of them. I think that this is one of the pieces that we should be collectively able to address. And it's not that difficult, to be honest. I think that it is creating the right awareness and the right networks, because, as I said before, the science has advanced a lot, and I think that for many people, we could find a solution.
Great. Thank you so much, Javier. It's been interesting. Thank you so much. Take care.
No, thank you, Amanda.
Thanks.